Xeomin and Botox are pretty much the same thing. I like Xeomin a little bit better. It's not a lot better, but it's slightly longer lasting, slightly quicker onset. People really like that. You never make antibodies to it. It's a little bit more precise, but the dosing is exactly the same as Botox. So she's had Botox before last in March, and I can see she's pretty smooth right here in the glabella. Her forehead's pretty smooth, and she's got a lot of what we call crow's feet, and they kind of extend out onto her cheekbone. So my goal is to get her eyes to open up a little bit more, and she feels like she looks a little tired. And when I do the crow's feet, I'm going to actually put 4 shots right here. 1, 2, 3, 4. And these are going to go away, and these are still going to be present. The cheek lines. Now, if we go ahead and treat the cheek, there's a possibility of messing up the smile. She would not like that. So I wait about 2 weeks, and when she comes back in, I do a called micro Botox, where I'll do microscopic doses right along here. And the reason I wait 2 weeks is that I might not need 2 units, might not need 6 units, so I'll know better. So right now I'm going to do a little bit on her forehead, her glabella and her forehead. Now I see a lot of women in our practices that are new to us, and they're used to getting their foreheads hit so they can't lift their eyebrows, and that actually looks fine when you're young, but as you get older, it makes you look fake. It makes your brow look kind of weird, and it actually drops your brow. And there's a trivia question, I don't know if you know the answer to this, but what looks more attractive on a woman when it's droopy? Nothing. Nothing looks more attractive, so we don't want to knock out the only muscle that lifts up. So what I'm going to do in this case, even though she doesn't have wrinkle here, what we call the glabella, I'm going to weaken the 5 depressor muscles: procerus, depressor supercilius, and corrugator supercilii. That way her frontalis lifts her up. I see commonly people treating up here. There's several big mistakes. You know, I write a blog this week and called it 5 biggest mistakes Botox injectors make. And the number one is going after the forehead with a new patient. It's really not necessary. You can get away with it when somebody's very young because they don't care if they have a dropped brow, but if somebody that's more mature and has a little tiredness to their face, we don't want anything drooping. So squeeze tight like you're mad. So she's got what's called an omega pattern in her muscle. Relax. It's about 9% of women have an omega pattern where it kind of jumps up. Procerus, depressor supercilius, depressor supercilius, corrugator supercilius. We give her a little secondary shot on her depressor supercilius because her ride's high. She's got what's called an omega pattern of glabellar complex. There's 5 different patterns we see in the glabella. I'm going on the orbicularis muscle, which is also a depressor muscle. This will allow her brow to lift. And it's 12 units, so I'm using 30 units in the glabella and 25 in the crow's feet. And that's about average. We see that men would take a little bit more, women under 30 a little bit less. What's going to happen now is her brow will start lifting up. I'll recheck her in about 2 weeks, and she's still probably going to have some secondary smile lines. I might be adding 6 units out here. Very little tiny blebs. So I take a little more diluted Botox, and I put little tiny blebs into her skin to soften those. And again, the reason I wait for that is that maybe half of them are going to go away today, maybe a third of them are, and I can better predict what's the minimum number. So we want to do maximum effective dose on the glabella and the crow's feet, minimal number on areas we don't want to alter certain facial expressions. So thank you very much. How much pain did you have with that? None. Right, thank you.